This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome back to another episode of Impact Healthcare. And, normally I'm speaking to somebody that, is a 15, 20, 30, 50-year vet in this business. My guest today is relatively new to the industry and has an interesting vantage point based on what he's seen as in his own life. Daniel, welcome to the show. For those people that don't know who you are and your great company, give us an introduction.
Yeah. So thanks for having me. My name is Daniel McCauley. I'm owner and founder of Mac Consulting Group.
And Daniel, you are not a health benefits guy by trade. What have you been doing with your life, and what got you into this business?
Yeah. So this is my third career. I did aerospace engineering in the Air Force, which sounds a lot smarter than I actually am. So keep that in mind. I then went into the tech space, worked in the tech space for about a decade. And then I got into insurance, not even in healthcare, not in the health side, but I got into insurance because my dad's owned his own insurance agency for almost 60 years now. I did it to honestly hang out with him. The stuff in the tech world went good. Things were okay. And he's 80 now. Well, he was 75 when I made that decision. It wasn't foreign to me. I put my first insurance packet together when I was, 8 years old. And, I'm not going to say that he paid me an ice cream because that would be against, the law.
Child labor law. Yeah.
Yeah. Child labor laws, of course. So I got into this industry to spend more time with him. And that's morphed into, just because of coming from the tech industry, that's morphed into something way more than I thought it would when I first made the change.
So Daniel, you and I connected, I'll say, off of a story. If you don't mind sharing, however much of that story, I think a lot of people will resonate with what I'm assuming from an outsider, something that is the fire that is in your belly to change this ugly beast. You mind sharing that story?
No. So me and you met almost 3 years ago, and you're the only person that's been speaking at a conference where at the end of it, I was one of those people that like beelines it to the front and is like, give me 5 minutes right now. I don't know if it's an ego thing or a pride thing. I don't know if there's anything negative about it, but you're the only person that I've ever done that with. And I don't know if you remember, but my question to you was, is this all true? And it was because you were showing quality metric data in regards to healthcare. And, coming from the tech space, data was what I did all day long. Data in, data out, and business analytics to drive things forward. Those weren't just cliche statements. They were real. That was my day. And my reason for asking you if it was true is because as I was sitting there listening to it, it made me think of my dad. Again, he's the reason that I came over to get into this business. And to make a long story short, about 20 years ago, he was in a medically induced coma for about 60 days altogether. He lost 75 pounds over that 60-day period. He's 5'8". I don't know. Let's be generous and say he weighs 200 pounds. So yeah, it's just to give you some reference. He's not 6'5", 300 pounds, able to handle losing 75 pounds, right? And the thing that stood out to me is during that process, they removed his gallbladder. And when he got done with out of the medically induced coma, he gets out of the hospital, they couldn't tell us what was wrong with him. And to this day, almost 20 years later, they still are unable to answer the question of what was actually wrong with him. And when I was listening to you, the thing that I couldn't get out of my head was They removed a body part and don't know what, and can't answer what was wrong with them. And then I'm looking at quality data and I'm like, we have no idea. I have no idea if the person that was working on my dad was the top rated doctor doing that in the hospital that he worked in or she worked in, or the 20th, rated doctor in the same field in the same hospital. And, that time in my life, I've got, 2 siblings, my mom's still with us. That time in my family of thinking you're going to lose a parent because of medical things and it lasting 60 days was gut-wrenching, day in, day out, over and over and over again. And sitting there and realizing that quality data was out there that we didn't look at, that we didn't access, it made me feel just helpless in the sense of how many other people have similar situations going on right now and have zero idea on how to evaluate or work with hospital, insert doctor, insert specialty, whatever it might be. But yet we're doing that anytime we travel to go find the best pizza place. We're looking at the same quality data that we're not looking at when it comes to healthcare. So anyway, long story short, to the thing that is driving me now is that was an answer to a question that I didn't have. I didn't have a question about what's quality look like in healthcare until I listened to some of the things you were saying. How many people out there today don't realize that data exists and are just walking down the road hoping everything's just going to work out? 90, I don't know what the actual number is, but it's in the 90s. It's got to be.
Yeah. Yeah. So and thank you for sharing. Thank you for the comment. It's interesting. I will have to give a shout out to a business coach, Steve Napolitan. I had never told the story about my parents until I was 40 years old. So I was already in this business, 17 years before, I had the courage to tell a story. But, I think it's interesting. I find the common denominator of everybody that I am intrigued to have as a guest on this show, because we call it Impact Healthcare, not because we want people that are doing the same old stuff that everybody else is doing, because obviously we want to impact healthcare in a positive way. I find that common denominator that somebody experienced something or saw it for themselves and says, this is just stupid. Why are we doing it this way? And yeah, it might be harder over here, but I'm okay with that because I know how this story ends. And what are those common conversations you and I have is all around a word. And the word has become just normal. But I don't think, and if you and I went down a rabbit hole about this word, but the word being deductible. And, I don't care whether you're watching a little Geico commercial or whether you're talking about your home. Deductible is just a term that's in our business. But in the way that we think about this word, let's dig down on that word deductible and why it might not be what everybody thinks it is.
Yeah. Yeah. I think, you tie 2 of these things together. The word deductible is uncomfortable. If you ever have to use the word, nobody's comfortable about that, because that means money's coming out of my pocket. Who's comfortable? Why would we be wanting to do that, especially when you're relating it to healthcare? Well, one of the things that ties back to the story of the fire and the passion is that I was uncomfortable sitting there. And so I think, as we go down the rabbit hole of deductible, one of the things that is true about really understanding how health insurance is built, how can you put a plan in place that's going to be centric around the member and around the employee, is that means that you're going to have to share information that's uncomfortable. And that foundation, like I've got a client of mine now, a few hundred employees, where their CFO the other day said, before we were doing all this, we were happy. We were comfortable. And it was because we didn't know what was going on. And, the last few months, there's been some hard things that just happen with any kind of change management. Got nothing to do with, changing one plan versus another or a different plan or whatever you end up picking, just change managements, it can be tough. And now that we've gone through that, we're sitting on the other side and we're realizing the only reason that we were happy and the only reason that we were comfortable is because we didn't know what was actually happening. And so when you think about the word deductible and tie those two things together, what's interesting about the word deductible is we've talked about this before. I think the analogy that I think you've shared, I don't know if you've done it on here before, but the idea of if I put an employer, an employee, and a medical provider in the room together, and I take a coffee mug and sit it in between them, right? Small plug for North Carolina too. If I take a coffee mug and sit in between them and say, employee, do you want to pay out of pocket? No. Employer, do you want to provide a plan that makes your employee pay out of pocket? No. Medical provider, do you want to charge out of pocket and chase down money from the people that are getting services for you? No. Well, that little coffee mug in the room is the deductible, and everybody just said, no, I don't want that. So why do we have one? Yeah. And the answer to that, I think, is uncomfortable. I do. I'm gonna tell you one more story, if it's okay, tied to this. So, I think one of the things that's been interesting is I've had that conversation with people is everybody agrees, except for once you get to the medical provider. You get to the medical provider and they don't understand, well, why do they not want a deductible? I know why I don't want one as an employer. I know my employees don't want one, but why does the medical provider not want one? And if you go do research on this, this is a real case here in North Carolina. I couldn't tell you what it is nationally, but large independent practice, hundreds of employees. They see thousands of patients. They're averaging 35 cents on the dollar. That's how much they collect. I told the story to the owner the other day of a manufacturing company. They collect 35 cents on the dollar. And I'm gonna give you an example. You go get a colonoscopy done, and it's $1,700 through the major insurance carriers. All right? The cost of that colonoscopy from this practice is $461. So it cost me $461. Through insurance, it's $1,700. If I go cash pay for that same colonoscopy directly, it only cost me $900. Well, how can they sell it to me for $900 and also sell it to me for $1,700 depending on how I pay for it? Imagine if you walked into a restaurant and you're like, you know what? I'm going to get a steak. If you pay cash, $22. Now we're going to triple that if you use a credit card. You're going to walk outside and pay the $3 fee at the ATM and walk right back in and get the steak. You're not going to sit there and use a credit card. Why would you do that? It doesn't make any sense.
Right.
And so the thing that people don't understand about the deductible and the medical community specifically is that the reason they don't want it is because the amount of $1,700 example in colonoscopy. If you're on a $4,000 deductible plan, you walk in, that $1,700 is coming out of your pocket. Insurance is paying $0. How many people have $1,700? I think the math on it is 80% of people don't. So, as a ballpark. So that means I got two options as the medical provider. I either deny them care or I put them on a payment plan. Payment plan, all true story. Payment plan, $461 cost for the colonoscopy. Payment plan, day one, you got to pay $500 towards the $1,700 because that covers cost. So at least I've done that as a provider, which was what any business would want. I want to cover cost. $500. So now I got to chase down that remaining $1,200 because I'll see you if you cover cost. Now I'm chasing down that $1,200. And the amount of time that it takes me to get that money means that dollar just goes down in value, which is why they end at 35 cents on the dollar is what they bring home. So if I could go in there and say, hey, I'll pay you $900, double cost. You don't have to chase it at all. I'll pay you right now. They're going to go, yeah, absolutely. That works for me. Right? So you pause there. Owner's tracking everything I'm saying. Next question out of their mouth is, well, how come it's $1,700 to the major insurance carriers? Help me explain that. And this is the wild thing. This is one of the things I've learned in the last year or so. The reason it's $1,700, there's two of them. One is because some people can afford $1,700. And so if we charge $1,700 and the people who can't afford it, that other 20%, they're going to make up for some of the people who can't. Right? Which, do I agree with? Do I not agree with? Do I understand that there's maybe a business component there? If that's just how the world works, maybe. Second reason, more people have to make money off of the transaction. And so you think about that as an owner of a company, tie all this back to the word deductible. Employee doesn't want one, employer doesn't want one, and the reason the medical provider doesn't want one is it makes it harder for them to do their job to actually see patients because they have to have X amount of time chasing down revenue. I'll give you one more story on this. This organization that I'm talking about is private practice. 10 years ago, they had two that worked in the accounts receivable, accounts processing, financial arm of this division that I'm telling the story of. Now, 10 years later, they have 22. That's how much time is going into the administrative function of getting that business paid. That sounds like a pretty big problem, right? So don't let me keep rambling here. Let me pause for a second. We've talked about this word a lot. Tell me what that story makes you think.
Well, I want to validate your stats with stats that I have heard, and I'm going to give some anecdotal stories. I have heard 30 to 50 cents on the dollar is typically what is collected. So right in where you were talking, some stats, 67% of personal bankruptcies happen because of medical expenses. Mm-hmm. Over half of those people had insurance. Okay, so my parents were one. We had insurance. How many people can afford a $5,000, $10,000, $15,000 out-of-pocket max repeatedly over a course of a couple years, right? The last study I saw that the average human being in the United States does not have $400 to $1,000 in savings for an unexpected event. So assuming most people are not thinking this year, I am really going to go get a medical expense that I don't need, and they didn't put that in an FSA, an HSA, an HRA, or they're not just saving that out for a rainy day, the majority of people don't have $1,000. The average deductible today is $3,500. The average out-of-pocket max is $7,000. So all of those validate your stories. But when you think about that, and again, let's just take ourselves out of being practitioners in this business. Mm-hmm. When the average person doesn't have $1,000 in their bank account, the average out-of-pocket max is $7,000, and the average salary is, let's just call it $60,000 to $70,000. Now we're starting to think, $60,000, let's go 70 because I could do that math. $70,000 on a gross take-home pay, that is already 10% that I could potentially hit. On a net take-home pay, that's going to be more like 15 to 20%. And that's assuming that no other eggs, gas, my light bill went up. And so when we think about this in today's age, an employer, an advisor, anybody saying that the right answer to solving the question of how do I lower healthcare costs, and that answer being, let's just increase the deductible. Wow. Makes more people file bankruptcy. It makes more employers have plans that they spend a lot of time and money on that people can't even afford and don't like to use. And back to your medical provider, hospital, doctor, doesn't matter. They don't like collecting it. And now people are filing bankruptcy, which doesn't make anybody feel good. Right. It just doesn't make sense. So then I ask somebody who dedicates their life to this conundrum we just talked about, what is the right answer?
Yeah. I think I think, one more little small thing on the problem. Milliman came out with a report, family of four, premium cost. Average family of four, $32,000 in premium for the year. That's employer plus employee in what we do, right? That's how much I got to spend to insure me. And then I've got to carry everything you just said, $7,000 out of pocket, blah, 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 blah. And so when you think about the total cost of insuring me, it's for me, how I look at it is like, okay, I got my premium, then I got my out of pockets. What are the things that I can do to start, controlling the amount I'm going to have to spend? Well, one of them is I'll just go cash pay for things because there's no other people in the transaction, right? It's just me and the provider. There's no middleman. There's no insurance. I'm not paying anybody else. I'm paying the person that's working on me, and they're taking my money. Well, you can cash pay as an individual all day long. That's not a hard thing to go do. Probably most people have thought about it or done it at some point in their life. But how do you do that on an employer plan? Because you can't just everybody just go cash pay. People would be like, wait, what? No, we're not doing so that's why we have insurance. What are you talking about, cash pay? So one of the things that we have in every single client that we work with, every single one of them has this, is a direct contract aggregator, partner, vendor, whatever word you want to use, right? A direct contract partner inside of the plan, which is the person that says the plan will take this quote unquote cash pay approach for the individual. So no out of pocket, no deductible, no copay, no co-insurance is what essentially, the result of cash paying is when you do it through the plan, through a direct contract scenario. So as an example, client of mine in North Carolina, they actually had, I was talking about my dad and gallbladder removal. They actually had the same thing happen this year on one of our plans. And they go to the doctor. We get them scheduled. Well, the plan gets them scheduled. They go see that doctor. They have a gallbladder removal and $0. Cost the employee $0. No copay, no coinsurance, no deductible. That same thing on their prior plan would have cost them about $3,000 out of pocket. How's that possible? We go back to the whole story I was just talking about, the colonoscopy. That direct contractor partner connects with that practice that they have a contract with that says, hey, I've got a negotiated rate. I'm going to pay you up front. Instead of you charging me $1,700 in my colonoscopy example, I'll pay you $900 up front. So by the time the person shows up, you don't have to collect anything from them. You don't have to chase anything from them. Just we'll pay you up front. We'll get it taken care of, which is 80, 90% reduction in how long it takes the practice to get paid. It's 100% reduction in, the receivables aging process because they're not tracking, they're not chasing any of that money down, so on and so forth. So in a nutshell, if direct contracts exist in your area with medical providers, why aren't they built into your plan? Because it's a way that you can access the medical community at no cost. So ask your broker if the words direct contracting in your plan don't make sense to you. Repeat that to them. And then two, if they're not in your plan, they're not allowed to be in your plan, whatever it might be, figure out the answer as to why. Where I live, the county that I live in, there are 22 medical practices in my county that we have direct contracts with. The people that are on other plans that don't have those direct contracting avenues are sending, guaranteed, they're some of the largest private practices in the county I live in. Guaranteed over the last few years, they've had at least one employee go to the same practice and pay out of pocket for something we get at $0. So I think you do some homework on, why that isn't in your plan. And if direct contracting is completely foreign to you, then know that there are your neighbors, your other businesses around you. They are using this form to control out-of-pocket expenses for their employees, which by default, remember we took that claim, colonoscopy $1,700 down to $900, by default reduce the cost of healthcare, which by default is our only chance to reduce the cost of the premium so that we're not paying $32,000 for a family of 4 because that's not affordable. I don't care who you ask, right?
So I want to make sure that everybody understands, back to your coffee mug and the 3 people that are sitting in the room. In your example, the last one, right, the gallbladder, the member didn't have to pay $3,000. Check, they won. They got equal to, if not better, quality healthcare for free. The employer got to offer a better benefit to their number one asset, which is their employees. That employee is going to be super thankful to that employer that they had a $0 out of pocket, because again, $3,000 to anybody is, at least the worst case scenario, a really nice vacation. On the flip side, the employer didn't pay more for that gallbladder. What would that same gallbladder, what did you pay direct versus what would have been through a normal traditional health plan? The cost that the employer or the insurance would have been paying.
Yeah, top of my head, I'm going to go with $7,500 total after we got done, going through the direct contract route. Let's say $2,500. So let's say the employer saved $5,000 on this one transaction.
Okay, so $5,000 here on a $7,000 dollar transaction. Again, not good at math. That's a big number. We're talking 60-70% savings.
Yep.
I'm going to go back now. So employer's happy for 2 reasons. I saved money over here. I offered a better benefit to my people over here. The third leg of that stool, the third point of the triangle, however we want to talk about it, is that healthcare provider who got their payment pretty much instantaneously, collected more than it cost them to do it, and they assessed what they needed to make as a margin, and probably got, by the time it's all said and done, more than they would have had it gone back the other way.
Right.
So those 3 people win. We have to point out the obvious, that the only person that's not in the room in this conversation is the insurance company. That person didn't necessarily win. When we look at the stock prices of the major insurance companies, the salaries of their CEOs, I think they're all making between $20 and $30 million on annual compensation. The person who is losing in this scenario, or the person who maybe gets in the way of this happening more often than not, is the insurance company.
Yeah. And I can't tell you, they're not in the room, right? In our analogy, they're not in the room. I can't tell you if they win or if they lose, but I can tell you that they're not my focus. My focus is the employee and the employer, and them having connections to care at the best price possible. And if that involves 3 people, employee, employer, and medical community, I don't care about who else could potentially be impacted, right? I'm going to give you one more, I know we're kind of close on time, but I'll give you one more thing that I think is impactful when it comes to direct contracting. We're working on one right now with a fertility clinic. Think how many times people stop going to fertility clinics because of cost, right? How many people know that you could direct contract with a fertility clinic, and that might give you a whole nother chance? Let's just say we pay 25% less because we cash pay for it via a direct contracting model. That means instead of me getting to try 2 times to have, a son, daughter, child for the first time in my life, instead of me getting 2 times, I might get 3 because I can afford it a whole nother 3rd time. And I think, I picked that example because, having to go to the fertility clinic's already hard enough as it is. Just like having a body part removed as a gallbladder, it's already hard enough as it is. How can we make it to where cost doesn't take you from going to get the care that you need? And how can we make sure that the medical community makes the money that they need to make without having to hurt the employee and the employer, or without having to keep them from getting care?
I mean, you hit on a subject that should be the driving force of everybody who gets out of their bed and calls themselves a healthcare professional or health insurance professional, right? Is, look, my parents, it was a drug, one drug that you're going to take for the rest of your life post a bone marrow transplant that is literally keeping somebody alive. So, take these examples that we've talked about, right? A life-saving medication, someone is going to have to make a decision. My parents were $62,000 in debt on a credit card when it was all said and done. And so I think about this, like we talked about this after I got into business as an adult. Like, can you imagine the lack of productivity when mom went to work, knowing that they're got a hippo swallowing this debt every month, having to make payments where you're seeing a 18, 20, 25%. Like, that is the worst case there. So that's a life-saving thing. In the fertility thing, it's, hey, let's not save a life. Let's create a life, which should be one of the most joyous occasions. In your dad's perspective, it's like, hey, yeah, maybe that wasn't a financial conversation, but the way healthcare is designed today doesn't have some of the just natural components that you expect as table stakes in the rest of your life. Like, nobody buys a car in today's era without reading a consumer review or going on CarMax and Carfox and all these. Like, you don't buy a house without shopping your mortgage, getting a real estate agent. But how many people go rush off to access healthcare without thinking twice? And how many people who call themselves advisors build health plans just taking it off the shelf when we already know how that book ends?
Yep.
So I love the story. I want to leave people with two things. Number one, you've got a platform, right? We're sitting here and you're not a 40-year-old vet, in this business. You are somebody who came in from the outside, and you've learned this and become a force, to be reckoned with out there. You're doing some creative things. You've got an audience. Hopefully that audience is thousands and thousands and thousands of people that listen to this podcast. What would you tell them, in regards to what is now an employer's second or third largest expense and what is a huge expense for everybody that is a consumer of healthcare? What would you tell them?
That they're right about the problem. That they're right that it shouldn't cost as much as it is. And that the piece that, is probably missing is, have they sat down with anyone that could describe a solution to them? And if they sit there and go, there is no solution, then that's the thing they're wrong about. They're right that the problem is exactly what the problem is. They're wrong if they think that it can't be fixed better than it is fixed today. And if they're getting that answer from whoever they work with or whoever's in their partnership or Rolodex of people today, then the answer is expand your Rolodex to, Lester, people like you, people like me, other people that are on, this side of the fence that are using actual real data to prove that these things are true. Like, I'm not lifting up a rock and being like, holy crap, we found something that no one knew was there, right? So they're right about the problem. If they think there's no solution, then they're wrong about that, which means they need to add a new name and a new number to their Rolodex.
Speaking of that, if somebody heard this and says, I need to talk to that guy, where does somebody follow Daniel, get a hold of Daniel if they want to talk more and learn more about you?
Yeah, so I'm on LinkedIn, obviously. My email is another good one. My website's macconsultinggroup.com. LinkedIn is Daniel McCauley, and my email is daniel@macconsultinggroup.com. All three of those, you could get to me.
Awesome. Well, I don't love that your dad's situation drove you to this business, because it's not a great situation, but he's still alive, he's flourishing, and you guys get to hang out more. So maybe that is the silver lining in that. But I thank you for being somebody who wakes up every day choosing to do the harder road, and not because the harder road makes us more money, although I know that neither one of us are doing this for charity, so that we hope this leads us to a better place, but more so, we hope that we impact thousands and thousands and millions of lives. So I just thank you for being a leader in that.
Yeah, and then thank you for being in the trenches with me.
Awesome. Well, guys, if you didn't get chills hearing stories, or maybe not even chills, if you didn't get pissed off, hearing what is possible, then A, check your heart rate, but B, just do me a favor. If you did get pissed off or learn something, hit share, make a review on this. The only reason we do this, we don't have sponsors. I don't get paid for this. The only reason we do this is that more people learn that these things are possible, because what Daniel and I get to see every day is the impact that these kinds of strategies and these kinds of things have on the everyday person. And I know I put my head down on the pillow very comfortably at night. I know Daniel does too, and we want just more people to find their way. So hit share, hit like, make a comment, make a review. If you got any questions, give us a shout. But Daniel, thank you for helping us impact healthcare.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.